Good afternoon, everyone, and welcome to QI Talk Time. This is Roisin here, and I'm actually broadcasting from Cork, would you believe? And we're delighted today to have the UL Hospital Group with us to tell us about their journey in quality improvement. So today we have a number of speakers. We have Dr. Mendonaro Imcha, sorry if I'm pronouncing that wrong. She's a consultant obstetrician and gynecologist at the University Maternity Hospital Limerick and is the head of perinatal mental service. She is Chief Clinical Officer, Information Officer in ULHG, and also the chairperson of ULHG's Quality Improvement Committee, which we're probably going to hear a good bit about today. She's tasked with duties of sustaining a quality and safety culture, as well as building the infrastructure for systemic quality and safety practice. Thanks so much for joining us today, Dr. Imcha. Then we have Dr. Louise Reid, who is a nurse by background and has an MSc in Health Informatics from TCD, subsequently completed her PhD in software engineering, and her role is the Q Quality Facilitator for UL Hospital Group. She's a key leader in the development and alignment of QI across the UL Hospitals Group and is driving the development and progression of a number of information systems within the hospital. So thanks, Louise, for joining us today. And lastly, we have Deirdre Mullins. So Deirdre has worked in a number of national programme management offices, such as Children and Families and System Reform Group and national projects. In 2017, Deirdre joined the UL Hospital Group as portfolio lead for the Programme Management Office. She's passionate about QI and the ability to create sustainable change and bringing joy to work. So thank you so much, Louise, Deirdre and Imcha, for joining us. So the instructions for today's webinar, we want to keep it as interactive as possible. We've lots of people joining as we speak still, so welcome to QI Talk Time. And the phone number is 01 52600 58. The event number is 842 894 925#. And there is a chat box, so if you click on the little bubble there at the bottom of your screen in the blue icon, you can make any comments or queries or questions into that box throughout the webinar, and we'll deal with them as we go along. We're also very active on Twitter, so you can tweet at QI Talk Time. So today's webinar, we're hoping to cover the UL Hospitals Group's journey in quality improvement. And just to say, we've had lots of queries about this in terms of how different hospitals and centres have went about embedding QI within their own structures. So really, really interested to see what you're going to share with us today. So firstly, we're going to talk a little bit about the journey in QI for UL Hospitals, the framework for QI at UL Hospitals, the governance structure that goes with that, phase 1, awareness, phase 2, appreciation, and phase 3, accountability. So without further ado, thank you so much to my colleagues down in UL for joining us, and looking forward to hearing about your talk. Please do type in any questions or comments as we go along, and we'll deal with those at the end. Thanks so much.
Thank you, Roisin, for the wonderful introduction that you have given us. We are very excited to be here today, and hello everyone who is joining us at QI Talk Time. So we are going to share our journey of the quality improvement we have had at the UL Hospitals. So I'm going to start with the initial phase. My name is Naro Imcha, and I'm the chair for the QIC, which is the Quality Improvement Committee at UL Hospital Group. So in January 2017, UL Hospital Group initiated the formation of the QIC, and this was with the support of the CEO, Professor Colette Cowan, and our Chief Clinical Director at that time, who was Professor Ballberg. So I was asked to chair the QIC and was tasked with the responsibility of organizing QIC. And the Quality Improvement Committee was formed at that time with multidisciplinary team. And this multidisciplinary team was represented by all directorates. At UL Hospital Group, we have 4 clinical directorates and 1 non-clinical. And this was how the Quality Improvement Committee was formed. So one of the first decisions that we had to make was to define what this Quality Improvement Committee would do. So it was very clear from the beginning that we would not be directly involved with executing the project, but we would be acting as an enabler, because we knew that people in the field are the most able and more equipped to carry out the quality improvement projects that was appropriate for them. So in order for us to act as an enabler, we decided to concentrate on two things. One was to create a culture of quality consciousness within the acute hospital group. And the second one was to lay out the structures and processes that would make it easy for everyone to carry out the quality improvement project. We didn't want to reinvent the wheel. There's been a huge amount of work that is done by the Quality Improvement Division in the HSC and by HIQA, so we incorporated this into our implementation process. So the fundamental structure that we put in place was our three-phase approach that we had. And the first phase was, one, to create awareness. The second phase was to encourage appreciation, and the third phase was to develop accountability. So in the first phase, we planned a project that was focused on just awareness, and we did a pilot project in a single directorate, which was the Maternal and Child Health Directorate. So during this awareness phase, we focused on two things. We focused on what and how. So the what was how many quality improvement projects were already in progress in the directorate, what was the common understanding of the staff around quality and quality improvement, or is there a common understanding of it? So that was the first thing that we focused on. The second one was how. Is there a standard methodology that the staff were using to do the quality improvement project? And we knew that there was a huge amount of work that was already going on, and was there a visibility, and how do we communicate this across the hospital group? So we launched this in November 2017, and what we did was we had a celebration day, which we called as the Quality Improvement Celebration Day, and we invited all the staff to showcase the quality improvement projects through poster presentation. So during this time, we also had a survey which we gave to the staff to fill out to see what their understanding of quality and quality improvement project was, what challenges they were faced with, and if they had any degree in quality or any quality improvement courses that they have done. So once we had this phase in place, what we did was we looked at it, and we had, I think, around 47 posters, quality improvement, that they projected during that day. So we had a full visibility of all the ongoing quality improvement projects that was there. And then what we could capture when we had visibility of all the projects that were going on. And we also looked at the survey, which we came to understand the challenges that the staff were facing. And we also wanted to speak a common language that every staff would know what quality is and what quality improvement is. So what we did was we uploaded all the projects into our document management system, which is the QPulse. We agreed on a standard definition of quality, which we took from HIQA, and the quality improvement definition from Quality Improvement Division. And we also decided to use a standard approach, which is the IHI methodology. And what we also found out that the staff were facing challenges in support while they were doing this project. So we had the weekly quality lunch and learn. And also we updated this progress of the quality improvement project, and we shared this across the hospital group, and that was our plan. So we had milestones for it. So November 17 was when we launched in Maternal and Child Health Directorate. The second one was in March 2018, where we launched in all the directorates. And in June 2018 and 19, as a part of our awareness plan, we had the Quality Improvement Conference, which was a national conference, and we hope to hold it annually every year. So with this experience, did was we could try and implement the framework that we were using to change the culture and create an awareness of the culture of QI within the hospital group. So we had the top-down support from the executive management team, which was recognizing all the QI efforts that were going on. We could allocate the QI resources so that we could create this culture of QI and also establish a governance within the hospital group. And the bottom-up enthusiasm, what we did was acquire QI knowledge to training all the staff so that we could do the QI project in a proper way and we could learn and share, and by encouraging everyone to participate in the QI project. And by doing this, we hope to develop QI champions who would further go on and spread the culture of QI within the hospital group. So with this experience, then we developed a 10 steps to excellence, which we use now for executing our QI project, which Louise will be talking about later on in the appreciation phase, and Deirdre in the accountability phase. And we also developed a QI starter pack, which includes information for the QI processes. So I'm going to hand over to Louise Reed now, who is our quality facilitator for the UL Hospital Group, who will talk about the next phase, which is the appreciation phase.
So thanks everyone for listening in, and as I say, I'm just going to go through the appreciation phase of our framework, how we began doing it and loving it. So this, of course, is not a linear process. Some people are aware. We're developing people through awareness, knowing it, learning it, and then on to appreciation, doing it and loving it. So what we wanted to develop for our hospital group was to have the community working together with the patient central, but I suppose we feel that we will be the patient ourselves, our family are the patients. We're not separated from the patients. We're all one group. We're all one community working together. So we're encouraging the involvement of everyone in this process. So what we wanted to develop, so we wanted to be quite structured in our development. So we wanted something that was simple. We wanted something testable, something repeatable, something that was effective, something that was enjoyable, and something that was replicable. So initially we were trying to keep it simple. We know there's many methodologies and there are many QI methodologies, but as I say, we were trying to just support the staff and familiarize the staff. So we brought them back very much to the basic models and methodologies. So we started with the model for improvement, and we started to coach and encourage staff through using the model for improvement. What we use, we call it our gentle pull system. So we're not pushing people to this, we're gently supporting them to do it. So again, as Nara said previously, we started with the event in the maternity. So we knew in the hospital there was an awful lot of really, really good work going on, and we wanted that to be shared and acknowledged. So we surveyed the staff to find out what they wanted in relation to quality improvement and clinical audit. So when we reviewed the survey, the same theme came out again and again and again. Just people wanted support. People were they were very aware of their responsibility for QI, and they were very hardworking in relation to QI. But we provided support with methodology, we provided support to put teams together. Anyone who wanted to engage, there was somebody to help them in the maternity hospital. So these are some of the actions we put in place as part of our appreciation phase. So again, QI, training on QI knowledge. So anyone in the hospital can have, they can have one-to-one training, they can have group training. We have, in order to develop our champions and showcase our projects, we let the experienced people go forward as we supported the less experienced people. We set up quality lunches where people could present their projects, and this supported staff. Of course, then they began to see how to do it. They began to see that it was not too difficult. They began to see their friends and their colleagues beginning to present. So therefore, they began to feel that, yes, I can do that. They began to know who they could talk to in order to support them through it. We learned and shared, and then we began to spread to other sites. So the lunchtime presentation, so this was just a good opportunity for people to showcase. So we have that in the maternity hospital every Wednesday at lunchtime. So anyone can present their QIs and their audits. We also have a working project going. So our current project is clinical handover, and communication and theatre will be the next project. So people can see a live project, anyone can sit in and contribute to it, and we use correct formal project management techniques. Following this, we have our support clinic, so anyone who feels that they have any more queries or they want any more support with that, they can just pop in. Then we did some cross-directorate collaboration, so we have, there's a Red Spot team, they call them over in the ED and UHL, and they have a very good quality improvement program up and running. So we engaged with them, and we saw that they were doing their slides very quickly and very efficiently. So 6 minutes, 6 slides, and we thought this is good. So we started to bring this over to the maternity and use that. So tomorrow we're launching so again with our spreading and our cross-directorate initiative, we're taking our lunchtime presentation, we'll go to UHL. They already have what they call the Nursing Nines up and running, so that's a very good initiative that came out of the nursing department with support from Una Cronin and the Red Spot team. So they present 9 slides, 9 minutes. So then, kind of to support for the rest of the hospital, we're going to commence the quick quips. So 4 minutes, 4 slides, people to present their QIPs. Following the quick quips, there'll be what we call the quick quip clinic. So anyone who sees this and feels they'd like to do something themselves, they can do that as well. We have a quality and data protection support clinic on Mondays. Again, anyone can pop into that. So this is some of the team. So we have representation from our GDPR officer. We've got our complaints officer. We've got the support from the ethics and the research ethics committee. We've risk advisors, and the biostatistician will be starting on Monday. So the back row there, some of our colleagues, Joanne O'Connor, Eleanor Mann, Owen Kennedy, and we've Annette Ridley and myself in the front row. So that's every Monday, 3 to 5, and there's also, before that, 2 to 3 people can book in, teams can book in if they want to, private session. So yes, we are promoting people to fix, we were constant QI, and we want that, but we also don't want quick fixes. We don't want people glossing over problems. So we also want things to be strategically aligned and deep and correct. So there's no just slapping a plaster on things. So with that in mind, as we became more experienced, we kind of realized we kind of went a little bit, bigger projects just became a little bit stronger, a little bit more teams involved. We started to put a lot of support into these big projects that we need to get over the line. So they run in parallel. So we have, they're supported and in parallel with each other. So we began to develop our 10 steps to excellence. So we kind of very carefully structure these projects and put them up on Project Vision. So by doing this, our team, our CEO, our executive management team, anyone can have full visibility of these projects. They can have a look, they can see where they are. We develop all sorts of reporting mechanisms from them so that you can just send in kind of high level, medium level, deeper reports as required. So what we have here now are some of the success factors for the appreciation phase. So we've got organizational culture that supports the implementation phase plan. There's a common understanding. So we're really trying to keep it fairly standardized, fairly simple that people can understand it. We've got widespread participation. We're very lucky. The teams here down in Limerick are fantastic. Limerick and Tipperary and Clare, actually. They're absolutely amazing, all working together, and we're providing between us all, and as I say, the team gets bigger and bigger. We're providing knowledge, training, mentoring, and guidance. And we're systematic, we're strategically aligned in our approach. So we have QI champions. So at the moment we have 130 that we're aware of across the organisation with quality improvement training, and we have 2 expert QI coaches. And we're continuing to train, we're continuing to support people to go on courses such as the RCPI course. Other supports, we've developed a starter pack that's up on QPulse, so they just have to search for that. We're developing an online audit registration process, so that's ready to go. We're just finalising the policy around that. We're using mixed methodology, so we're using the model for improvement, we're using clinical audits, we're using implementation science, and I suppose each one as appropriate to the task in hand. These are just some of the online registration templates. So we'll be registering our QIs and our quality improvements online, so we have evidence. And each of these we're aligning to the national standards for better, safer healthcare, so that we can show that again we're strategically aligned and we are developing and improving towards that the entire time. We've certified people, so this is our clinical audit certificate. So I don't know if you can see that, but if you go in, the skills demonstrated. So we're trying to push people through the entire audit cycle. So you get further, I suppose, certification. So the more steps through the audit cycle, the better quality of certificate you receive, or the higher level of certificate, I suppose, you receive. So that's the end of my section. So I'm going to pass it on to Dr. Mullins now, who's going to talk about the accountability section.
Thanks, Louise. So today I'm going to talk about phase 3 of our framework, which is all about accountability. And I suppose one of the most important things we have when we talk about accountability is a governance framework to underpin all the work that's going on. So Dr. Nara showed you the earlier governance structure that we had at the beginning, but as the journey has gone on, that has had to develop somewhat as the work has gotten bigger. So this is our newer version of our governance framework. You can see on the left in red we have our subcommittees at the directorates, as Dr. Nara described, and on the very right then in blue you can see the subcommittees such as health and safety, and with groups around what matters to you. And now in the middle you can see the newer section. This is all about the working groups. So we have a number of working groups as part of our QI group. We have one on strategy, we have one on communications, we have our quality network, which we're going to call QualNet. We have one which is dedicated to education and support, and we have our conference committee. You probably can't read them on the screen there, but we have a lot of different projects that are underway with those groups, such as the development of our strategy, we're going to develop a master class, holding the QI clinics. So all that work is going on, and that reports up to our QIC steering group. That reports into QualSec, which reports into the EMT and into our CEO, Professor Craig Cowan. So that's our governance structure. And then just back to show where I fit into this, I'm going to talk about the accountability, which is all about expanding our QI activity, and then that we all are living our QI values, and that QI is a way of life for people here at the hospital group, and it's all about continuous quality improvement. So as part of this third phase, the accountability, there's 3 different elements. So I'm going to talk about the education and the academic output, talk a little bit about the audit plan, and then about sustainability, or what we found to be important for sustainability to happen. So the first one is education and academic output. It's really important if we want to make QI more sustainable that we have this. So we have a lot of different things around education. We have learning notices. So when opportunities for improvement happen, those are shared, amongst colleagues, and they're published digitally. But we also create learning notices when we identify excellence. So at rounds and in various different ways across the hospital group, we share all these learning notices. As Louise has spoken about, the lunch and learn sessions, these are really important for people who are carrying out QI, because when they have to go and speak at one of the lunch and learn sessions, it really helps them develop, and it also shares that across the group. When we have our mentors in place, it's very important that they get to pass on the skills that they've learned, and then there's continuous growth across the group. And we're also working on some peer-reviewed outputs at the moment. So that's the education and the academic output, which is really important as part of our third phase. So then the next part is about planning for audit. So if we want to have accountability, it's really important that our QIs are including audit as they become more sustainable.
when we're looking at our conference and posters, you know, in the initial year, it would be about getting a QI in place. But now as we're evolving, it's really important that we can see that people are getting to close the loop on their QIs, that they're getting into the audit phase and making sure that they're more sustainable. So you can see the PDSA cycle there on the right. It's continuous, that we want to close that loop fully. The third part of this phase is all about sustainability. So the things that we've found are really important for that is that we acknowledge and we celebrate success. So it's a very positive group to be part of. It's really, really enjoyable. Our meetings are very enjoyable, and it brings a lot of joy to work when you can go to a meeting that it happens in such a positive way, and it's about improving for our patients and improving for our staff. So I think it's really important that we have QI as part of what we do, and that celebration of success is key to sustainability. It's also important that you have that clear leadership and commitment, and you can see that at the QI conference. People that are in the room, there's very senior leaders inside in that room, and there's also a lot of frontline staff who've been released from their duties so that they can be there and be part of this journey. So that shows that there's commitment on behalf of our management to ensure that staff get to be part of this as well. For sustainability, it's really important that we measure and share what we're doing and measure the improvements that are taking place. A big part of this has been about designing for success. It's really important that from an organisational perspective, we make it easy for people to do the right thing. It's important that we standardise our processes. It's important to remove unnecessary work. We shouldn't be collecting data if it's not important for the patient's journey. And sometimes we need to revisit things because you can see that things are collected for particular reasons which may no longer be valid as time moves on. It's really important that we embed the new practice and that we develop easy education and support materials. And I think, you know, Louise has talked you through all of those. We have our starter pack now, which is a very, very good starting point for people when they are looking to start their QI journey at the hospital group. So I suppose accountability is really important, and this is where the PMO will come in as well. You know, we've set at the beginning of the year our priorities. We've set all the different actions that we wanted to do at the beginning of the year, and it's really important that we track those. So the PMO is the Program Management Office, and there's a PMO in every hospital group, and there's a PMO in every CHO. And these started around the end of 2017 in general. So when I came into post at that point, one of the first people I met was Louise, who came and wanted to ensure that our projects and the way we manage our projects and the way our QI projects were being run, that they all align. So it's really important that you have, you know, that there is alignment across your organisation, that the PMO isn't telling you to manage projects in one way and that QI isn't telling you to manage projects in a very different way. That alignment between all the different parts of an organisation is very important in making things easier for people. So one of the things the PMO has done this year for QI is we track all our projects and project vision. This is just an example of one of the trackers that we're using. And you can see then we can assess each step and see where we're on track, what areas may need a little bit more work, or where we're encountering difficulties. And then this is similar, this is our QI education plan, and we can see those areas that we're doing really, really well, and then areas where we're a little bit more challenged. And it's very useful to track, because when you start to track things, you bring accountability, and that's important for things becoming sustainable. As I said, that's phase 3 of our model. So it's very hard to see this, but these are actually two of the screenshots from the system. So on the background there, that's one of the Gantt charts from one of our projects, and this system makes it very easy to track because it's cloud-based. So if I'm working on a project with Louise, or Louise is working on a project with somebody at a different hospital, they can all log on and see where that project is at. And then you can pull reports from that at various different levels, so that you can see that the picture in the background is quite detailed down to the nitty-gritty of a project, whereas then the screenshot on top is quite high level. So that's like a program report for how our overall projects, how they're all going. So the project vision system has been very beneficial this year in terms of pulling our reports that we submit to QualSec, and also then from managing projects on a day-to-day basis for those people who are working on detailed projects, in particular if the projects are across a number of divisions or across a number of directorates or have different stakeholders at different sites. So that's the project vision system. When we were deciding to do this presentation, we were saying what were the main drivers for QI, what has been really important for us as a hospital group in being able to get to this stage of our journey. So you can see here, these are the drivers we have. So leadership, it's really important that your leaders can be adaptive enough that you can flex and change and modify your plans as you need to in response to this kind of evolution of something. But they also have to be able to disrupt what's there and, ask the questions, why are things the way they are? Maybe things need to change. It's very important that we are patient-centered. So the big driver for QI is, of course, patient-centered care. Our staff, we need to have frontline action. And I think across the hospital group, we can safely say that our frontline staff are very driven with regard to QI. We have our QI conference every year, but last year then we also started with our peri-op conference and our nursing conference. So there's an awful lot of really good QI work being showcased at these conferences. It's really important that you build QI knowledge and skills, and we have a lot of work in place to do that. It's also important that you're measuring for improvement, because then people can know when they've achieved success and they can know how well they've done. And that brings a lot of joy to people as well, and they can see the difference they've made to patient time or the patient's time or the quality of care the patient has received. And then I suppose the last one out there is about governance, and it's really important that we have robust governance and you put in place your committees and your audit structures. So what are our future plans? Well, into the future, we want to develop and continue to develop our QI education program. Academic outputs, as I've mentioned, where work is underway to develop our QI hub, and work is underway at the moment to develop our strategic plan for the group with regard to QI. And then we want to collaborate with QID. There's amazing work being done nationally and a lot of resources nationally that are now available to us. So we want to ensure that we can use and utilise that as much as possible and collaborate. We also plan to have an annual report into the future and to continue to grow and develop our QI content. That's really important for us. So that brings us to the end of the presentation. We kept it very short because we wanted to see was there time for some questions. But I'm just going to leave you with two quotes. So one is from Henry Ford. It's coming together is a beginning, keeping together is progress, and working together is success. And another quote which is used all the time by our committee here, which is, we are not a team because we work together. We are a team because we respect, we trust, and we care for each other. And I think that's really important that they have that culture amongst people when you're trying to get onto this work. So thank you very much.
Thank you so much for such a wonderful presentation. Dr. Nero, who talked to us about the awareness piece, Louise, who talked about appreciation, and Deirdre, who brought us through that accountability section at the end. So much content, and I'd say we nearly could have a webinar on each one of those three areas alone to elaborate a little bit more on what you were sharing with us. We have today, we have over 46 people online, which is fantastic, from all over the country. But they're being very shy with some questions or comments. So now is your time to type that into the chat box. Just click on the bubble and let us know if you have any questions. I suppose one thing, we've had a few queries through the National Quality Improvement Team recently about setting up your own local QI network. And just to see there the amount of work that you've done, and obviously it's been over a number of years. I think, am I right to say that it started in 2017?
Yes, that's correct.
Yeah, so I suppose just for people who are online, not to be too overwhelmed, if you're only thinking about starting this in your organisation, it is a journey and there is a lot to it. So it starts small and build from there. And I suppose that's just something I wanted to ask, if some people who are online are thinking about trying to set up, a QI network within their own workplace, where would you think is the most appropriate place to start? Because there's a huge volume there. I suppose it's that awareness section, really, is it, that you'd recommend people would start with?
I'd say start with the awareness, but start with your champions. There's always people who are interested, and there's always people who want to do it. So if those people can start to join up together and start something small, and then just draw in their friends and bring other people on board, and anyone who wants to come in then, once they're enthusiastic, it just builds and builds and builds.
Yeah, so Donna Martin, one of the people online, is saying very impressive talk. Any advice on where to start, and how do you capture the positivity?
I suppose celebrate it all the time, and there's no incorrect way to, you let everyone in the door is the most important thing. And again, just
appreciation, inclusiveness, collaborating. Those are the things that those are.
And I suppose there's like, as you go forward, like we found, I suppose, nearly 90% of things that go really, really well. There's always the things that are more difficult, and not to be downhearted when that happens, and help people through.
And to have patience.
Yeah,
because that's very important, because it doesn't happen overnight. We have to be consistent with what we do. We have to be always motivating ourselves and to be patient, and it happens. Because we started in 2017 and we're here in 2019, where we're just getting there to put all this structure in place. So it takes time, and it is a journey. So
and I think it's important as well, also, if it's if you're strategically aligned with your aims, then you are going to have the support of your executive team, and you're going to have the support of people through the organisation. So that's all it's important to have that core to it as well.
And can I just ask as well, I know obviously you have your committee, but I know from previous discussions from other webinars, a lot of people, would say that this is on top of their already busy job, and that, that a lot of people don't have, or a lot of places don't have dedicated quality improvement facilitators, or people who are working in that area that can help promote and, build on education programs, audit, all the things you talked about. So just, if you wouldn't mind elaborating a little bit, do you have a specific QI role, or is it just that it's kind of embedded in everyone's role, that everyone takes a little piece of it and takes ownership of that?
I suppose to say everyone has two jobs, one to do your job and the other to improve it. So we really encourage it's part of everyone's role, and that we support them to deliver that part, and that's the fun part of your role, how you've made a difference and how you've brought it forward. And it helps. It keeps people motivated, and it keeps people out of ruts. And I think it's always been very positive. We've been very lucky with it.
Yeah, and internally, in terms of the education programme, I'd just be interested a little bit more in that, the development and the delivery of it. Who developed it, who delivers it? Is it like a train-the-trainer approach? Just be interested in a little bit more detail on that.
Right now, what we did was we concentrated only on one, which is the IHI methodology that we're using now, because we wanted everyone to have the same objective, speak the same language, so that we can. So that's what we are doing at the moment. But we are going to collaborate with the Quality Improvement Division so that we can train, and we are talking with them now, and that's in our future plan, to collaborate with them.
Oh, great, yeah.
How we can, how we can implement the education in a better way. Perhaps have money for the QI champions, that they can then come down here and educate the staff here in the hospital group. So that will be in the future plan for us to collaborate and put a more structured approach in place.
Yeah. And I know as part of that, to support that, Dr. Nero, we have obviously recently launched our National Quality Improvement Team QI Toolkit, which is available up online, which has 17 tools, I think, now, and it will be growing. We will be adding to it. But that is the real fundamental starter pack for people who are interested. If they go on qualityimprovement.ie, they'll find the Quality Improvement Kit there. And we did do a QI talk time on that. So that is something that certainly you could lift. We have had some other questions here online as well. Maureen Flynn is asking about, love the idea of making it easy to do the right thing. Can you share some examples of some of the things that helped you to do this?
Thanks, Roisin. I suppose making it easy to do the right thing is really important. And going back to your last point there about, people have other roles and this is just something you do on top of your role. That is the case for most of us as well, but it's also the case for the people who are trying to do at the front line, do these QIs. So we wanted to make it really easy to do a poster for our conference. We wanted to make it really easy for people to kick off. So it's about putting in place things like the starter pack, which even had, templates for our posters. It's just letting people know that this is what they need to get started and getting people started. Once people are on this journey, because it is such an enjoyable part of your work, it's kind of addictive that you keep getting involved in this.
Yeah.
And you keep, one of the ladies who asked at the beginning there was talking about how where would you get started? Well, there's a lot of things like the COPD collaboratives that are ongoing now across the country. There's probably QI in your area, you just mightn't know about it. I know the COPD collaborative here, I gave a minimal support to one of the people involved in it, and they went off then and they did their poster and they went to national and they won their prize. And I've seen on Twitter now they've gone to a number of conferences since. So it's a really good way of bringing joy to people in their work and making them happy. But again, it's about making it easy for them to get started, really easy for them to access the tools, not have 6 or 7 different kind of methodologies, go around sticking to the IHI methodology.
Yeah, having a standardised pack that everyone, exactly. They're just linking into that. Donna Martin is asking, she's logged in from Cavan, and she's asking about basically the possibility to view and use some of the documentation presented today. And I suppose as an addition to the slide set, we could include some of the lists of the tools that you had in association with the work that you're doing. If you wouldn't mind, that might be a way of sharing some more information.
Yes, no problem.
No problem.
Yeah, great. And potentially at a later date, we might get you back to give us some more in-depth detail into some of those tools. One thing that I was interested in was I think it might be part of your IT. You do have some nice IT supports there where you can capture the activity that's going on from a QI perspective. Is it QPulse or one of those platforms that you use that you have a register of QI activity at any one point in time? And I know a lot of organisations are interested in having that so it's visible at an organisational wide level. Because as one of you said, it's happening. People are doing improvement all the time, but often we don't know. We don't know about it. It's not visible. So it's a really nice way of anyone within the organisation getting a feel and a flavour for what QI is happening.
So we're using our existing system. So we're using QPulse as our quality management information system, and we're also using Project Vision for the bigger projects that we can, because we find that that's a very good way of managing them as well. We're strongly encouraging people to register, and as I say, we're making it easier for them. So we've just developed a web tool now to make it easier to get your audits and your QIs up onto QPulse. So anyone can just register them, or anyone can just pop them on. So then we begin to get visibility, and then as we begin to get visibility of them, then we begin to see the quality of them. We know they're there, but we feel it's better to see them, and then we can begin to improve the quality and begin to quality assure them. So that's an important part of our journey as well. And as I say, it is a journey. We start at the beginning, and then we begin to, we let people come in where they're at, and then we support them into higher levels of quality with it. And again, we find like across the group, everyone has different talents. Some things come very easy to some people, and other things come very easy to other people. So we kind of try to unite people and get people over their barriers.
Yeah, fantastic. Great. There is a lot of interest in your starter pack, so we might talk afterwards how we might be able to share some of that with people, if that's okay. Patricia O'Brien has said, thanks for 3 excellent presentations. I'm really impressed with the Central Support Clinic and the PMOs on each site/directorate. Do you think this has been key to your success?
Definitely. Because we literally took what the people said they wanted around the group. We surveyed, and the support was coming out again and again and again, and we just put it there, we just put it in place. There's no round door, there's no, the only bad question is the unasked question, so anyone can pop in at any level, and we don't mind if you've done it incorrectly previously, we don't mind where you're at, we kind of support you going forward.
Great.
And we can make the connections for people as well. So things, if you don't know how to progress in an area, if you don't know how to approach, we generally do know who to approach and how to do it. So
Great.
that's helpful for people. You know, there'll be a lot of, you know, nursing staff who are new, NCHDs, lots of people, they don't know the key players around the organisation, they're fresh to it. We generally do, and we've everyone there to help with that.
Yeah. One of the things actually as part of the project that we did in the NRH, helping to standardise their approaches to QI, we introduced an induction pack. So as part of their induction programme, there was a small piece on QI and how they did QI around here, basically. So it was a small introductory piece, but it just already weaved that thread of thought about quality improvement and the culture for improvement within the organisation. So it's nice to start from that point too. Maureen Flynn is saying, starting with what is already underway with an invitation to share posters locally is a really great idea, and helping people see the wonderful QI already in progress. Demystifying the processes with the standardised pack is great. Thanks a million for your great insights. And we have another nice positive comment from Donna. Great, thank you. So I don't see any other questions that have come up online. But I definitely think we might be extending the invite again to come back to Talk Time to even elaborate a little bit more on some of the sections that you talked about there, because it gave us a great high-level flavour. But I think there's lots of more learning that we possibly could explore through more webinars at a later date if you were willing to do that with us. Yeah, great. So I might touch base with you all in UL around what we could possibly share alongside the slide set in terms of the starter pack that might be beneficial for people to have a look at. But I just, unless you've nothing further to add, I just really wanted to thank the three of you for joining us today and imparting all of your wonderful knowledge and experience over the last couple of years. You've been very busy, all the work you've been doing down there. So thank you very much for coming to join us.
Thank you for having us, Roisin. Thank you.
Yeah, fantastic. So this will be recorded, and the slide set will be available on the QI Talk Time webpage. So just if you flick on to the next slide, hopefully you have the next QI Talk Time is in 2 weeks' time. Maybe we didn't get the, we have it there. Brilliant, fantastic. So that's with Dr. Aoife de Bruin from the UCD Health Systems. And just we're following up on a previous webinar that we've done before on the co-lead interventions. So it's collective leadership, introductory tools that are available for use. So they've just recently launched this, and this is a webinar that will go with it. So please do join into that. That will be our last webinar before Christmas. Thank you so much again to UL for joining us today. An excellent session, and hopefully we'll partner again in the future. And thank you all for joining in. We had 48 people online, which is fantastic. Thank you so much, and we'll see you next time on the 10th of December. Thank you.
Thank you.
Bye, Roisin.
Thanks.